Hello, everyone. Thanks for joining. This is Bill Thomas, National Sales Manager at Sedera Health. Today, we're going to walk through a pitch deck example on medical cost sharing with Sedera. So our objectives today when reviewing this slide deck is first and foremost, we empower our members to make smart choices around their health care. That means the freedom for them to choose where they think it's best to see a provider or a hospital for their health care. One of the reasons our phone line rings here at Sedera is that they're attracted to the costs of the monthly contributions to join Sedera. Typically, we're anywhere from 30 to 70% savings over the traditional carriers. And so people are calling and wanting to learn more about Sedera Health. So not only do we save 30 to 70% for employer groups on the front end, it's important to look at the back end as well. Our members are consistently telling us that they're saving a significant amount of money on the backside. So we don't use deductibles. We have everything is based on a need, and I'll get into that in a moment. So we have two membership types. We have Sedera Select, which is the Sedera community membership for employer groups. And then we have Sedera Access, which we launched several months ago, and that's the sharing community membership for association and membership groups. A direct primary care doctor that wants to offer this to his patients would fall in this category as well. So what is medical cost sharing? Well, first and foremost, it's big savings over traditional health insurance. As I mentioned earlier, 30 to 70% is what we see on an average basis on what groups can save. It is healthcare through community versus healthcare through insurance. So what does that mean? Every employer group or every association that joins Sedera opens up a corporate escrow account at the Business Bank of Texas. That money is ACH'd or transferred over to the Business Bank of Texas every month for the monthly contributions for that group or that association. We, meaning Sedera, act as the facilitators of those funds. We take a 9.9% admin fee, and the rest of the money goes towards healthcare sharing. That money will always remain with the company or organization's corporate escrow account. Sedera, it never touches Sedera's hands. So we just are the captains of this ship and the stewards facilitating this money as expenses come into the community. So unlike insurance, we are not motivated to not pay out claims or expenses. The only way Sedera makes more money is if we bring on more members, and that's very important to understand. Industry-wide, employer groups that are contacting us, we let them know that they're not alone, looking for an alternative to health insurance. In 2017, there was over $1 billion shared and over 1.2 million members nationwide utilizing medical cost sharing. And I'll share a slide with you in a moment. One of the things our members truly love is the freedom from networks. So no longer does a member have to look into a directory to see if his or her doctor or pediatrician or specialist is in network to see if it would be paid at 100%. Our members are free to choose on where they think they can get the best health care. Sharing begins at your IUA. IUA is a very important term to understand. That is the initial unshareable amount, and that's on a per need basis, and I'll get into more detail on that in a moment. And then lastly, we promote a healthy lifestyle. It's no secret that if everyone's healthy, we can lower costs and expenses for the community together. So this slide deck represents when Obamacare, the Affordable Care Act, took place in 2010. Nationwide, there was less than 100,000 members utilizing medical cost sharing. And as you can see in 2017, at the end of 2017, we went over 1.2 million members utilizing it. So our members are not alone in looking for alternatives to health insurance as the prices for health insurance skyrocket. So there's three categories when joining Sedera and looking at it. We have the large costs bucket, which is medical cost sharing, for instance, that go over the IUA. Some examples of that would be hospitalization, some surgery, or diagnostic imaging. Then we have the small to medium costs. We have 24/7 teledoc service, which I'll get into in more detail. And we have no limits and copays and coinsurance. Some examples of that would be the cold, sinus infection, flu, to name a few. And then last, we have preventative care. And some examples of that would be colonoscopy, mammograms, and immunizations for children. So what is a need? This is the heart and soul of what Sedera is all about in our sharing model. So I'd like to define what a need is. A need is one or more medical expenses caused by a single accident or illness. We have what is called the initial unshareable amount that I mentioned earlier. That is, I'll refer to it as our IUA. And that's what members pay before sharing begins for the need. So needs that exceed your IUA, and on the select product for groups, we have the 500, the 1,000, and the 1,500. On the access, we have those three plus an additional two at 2,500 and 5,000. So let's say, for example, I chose the $500 IUA. And if you look over on the left-hand side, this example, if I was out playing basketball, blew out my ankle, was rushed to the hospital where I had x-rays, emergency surgery, and I had pins inserted in my ankle. I did rehab, and they sent me home with pain medication and antibiotics. And then for the next 6 months, I'm doing rehab. I would be responsible for the first $500 of all of those procedures, and the rest of those bills would be shared with the Sedera community. Okay. Now, let's say after 6 months of rehab, I go out and I'm walking the dog and I feel a twinge in my ankle and some pain. I go back to the hospital and they do an MRI and they realize the pin has shifted and they need to do a second surgery. Because I did not go 12 months symptom-free, that second surgery would be at $0 for me. And the rest of that second surgery, those bills would be shared with the Sedera community, okay? Now, we limit our members' out-of-pocket exposure on the back end. So for an individual, if you pay out 3 IUAs in a membership year, we'd cap that and say that you would have 0 IUA for eligible needs after that point. Some like to call it a deductible. It's not a deductible because up until that point, you're still paying for the smaller stuff, but it does set that limit of putting out those larger IUAs on the backside. For a family, we limit it to 5, okay? So these bills, I'm gonna be getting these in over a long extended period of time because I'm doing rehab for 6 months. So how do I get these bills to Sedera? You can do several things. You can take our mobile app, our Sedera mobile app that's on your smartphone, take a picture of it, upload these pictures as they come in. You can collect them all at once and do it, or you can do it as you get them in the mail. They are sent to Sedera where a case management would take over, and through our mobile app, our members are able to observe where that need is in the process. So when they submit the bills, it goes to our parent company, the Caris Group, which does patient advocacy and bill negotiation on behalf of all the Sedera members. The entire time when Sedera or when Caris Group engages a hospital or a doctor to negotiate bills, our members are kept in the loop on where the status is of that need as it comes in. So Caris Group will be in touch with the hospital. The Caris Group will be in touch with Sedera as well as the member. And typically on needs that come in, we pay out within 7 to 14 days. Needs that need to be negotiated typically range anywhere from 30 to 60 days. So this is a real life example of our CEO, Jamie Lagarde. His son, Brooks, had chronic ear infections. This is prior to him being a CEO. He was on a traditional insurance plan where him and his family had a deductible of $5,000 per family member threshold. Brooks, they took him in for a series of antibiotics, booster injections, and doctor visits. And then finally, they visited with the ENT specialist who inserted tubes into Brooks's ear at a local hospital. On the left-hand side, you can see the 4 doctor visits, the specialist visit, and the surgery cost, totaling $2,525. Because they did not reach their $5,000 deductible, that is what came out of their pocket for that particular surgery and all those doctor visits. Now, on the right-hand side in green, had he been a member of Sedera, that total procedure and doctor visits for everything would have been $500 if that was the IUA he chose. Now, this procedure happened in the fall. The following spring, Brooks's ear tubes fell out. January 1st was the renewal on their insurance. So unfortunately, the deductible reset. They took him back in for the surgery. And because it reset, they had to pay out an additional $2,100 for that procedure. So in total, the procedure was over, $4,500. Again, had they been members of Sedera, the second surgery to insert those tubes would have been at zero cost to the Lagarde family because Brooks did not go 12 months symptom-free. So this is what it takes to become a Sedera member. On your application, we ask our members to initial that they will make smart choices around diet and exercise and lifestyle. It's no secret that if you do those things, that you can greatly improve the quality of life. And if we all do that, and we strive for healthy lifestyle and share in one another's health expenses, everyone wins, okay? Some of the personal commitments that our members have to sign off on are to not use illegal narcotics and to not operate vehicles while intoxicated. So if a member were to get behind a wheel and get in an accident and have medical expenses related to them being under the influence, those bills would not be shareable with the Sedera community, okay? So that's a real strong personal commitment. When someone joins, they understand what they're initially when they join. Now, should they have members in the car that unfortunately received some medical bills from the accident, we would absolutely share those for the family, just not the driver. Tobacco users are allowed into the Sedera community. However, there's a monthly surcharge of $75 per month, and that's for the entire household. Tobacco use is considered cigarette smoking, chewing tobacco, and vaping. The celebratory cigar is not considered tobacco use. Now you'll notice in the bottom left there is an asterisk telling you that tobacco users that are smoking at the age of 50 and older, they have a $25,000 per need sharing limit on the top 4 disease states associated with tobacco use. So heart disease, stroke, COPD, and cancer. So medications, this is the way we look at medications. We put them into 2 buckets. There's the curative bucket, and then there's the maintenance bucket. Curative would be the antibiotics and pain medications, going back to the example I provided you with my ankle surgery. They sent me home with antibiotics and pain medication. That's part of the cure. Therefore, it is shareable, just as all my other expenses would be for that need. Maintenance medications are handled differently. If I'm a member of Sedera and 6 months in, my doctor wants me to get on high blood pressure medication because he has noticed that my blood pressure has been rising and rising and he wants me on it, it's shareable for the first 120 days following a new diagnosis. However, after that, it's up to our members to pay for that medication. Therefore, we encourage our members to use free app such as GoodRx, where members can type in their medication and it'll prompt them local pharmacies around their work or their home where they can get medication at a discounted price at those particular pharmacies. However, there's some medications out there that are extremely expensive. We do have a buy-up program through Liberty Benefits. It's an optional discount program where an entire household can get access to significantly reduced drugs throughout the world that have 90-day mail order supply. That is a $27.50 option, and the member can add that to their membership at any point. So if they're a member of Sedera and they all of a sudden have to take a maintenance medication that's extremely expensive, they can add Liberty Benefits at that time. So this is probably the most important slide to understand on the deck, and this is the major reason why someone would join Sedera and would not join Sedera, and it's around pre-existing conditions. So unlike insurance, we, in our guidelines, put some stipulations around pre-existing conditions. We do not tell anyone they cannot join Sedera. However, the guidelines are written in a way that it might not make sense for certain people to join. And let me walk you through that. So pre-existing conditions, when they fill out their applications, they have to list any observable symptom or treatment that they have received in the last 36 months of their effective membership date. Anything they list would be considered pre-existing. And here's how that looks. So in year one, there would be $0 shareable for that specific condition. In year two, in year three, in year four, it tiers up. So in year two, there would be $15,000 allowed shareable in the Access membership and $25,000 in the Select membership. And then after year two, it would go up to $30,000 in Access, $50,000 in Select. Finally, at the end of 36 months and 1 day, all members would be able to share for those pre-existing conditions after year three. Now, even in year one, the Sedera Member Services team is still available to assist our members in locating cost-effective providers and alternative services and to negotiate their medical bills that exceed that $500. Just because it's a pre-existing condition, we're still there to help out our members. Now, the four that you see at the top, high blood pressure, high cholesterol, sleep apnea, and non-insulin dependent diabetes, as long as they're well controlled, they are not considered pre-existing. And therefore, if anything were to go wrong with a member with those conditions, those bills would be shareable. So some of the ancillary services that we provide our members, the first one, telemedicine. We partnered with Teladoc, which is access to board-certified doctors 24 hours a day, 7 days a week, 365 days a year. Our members utilize this extremely well, and we've basically built in the Platinum service, which allows our members to have freedom to use it as much as they want and no additional co-pays. So the way that would look is they could call up, or they can make an appointment on their computer or their smartphone app, where a Teladoc board-certified doctor, typically within a 5 to 8 minute average wait time, will call back, listen to the symptoms, make a diagnosis perhaps, and even write medications where the members can pick them up at their local pharmacy at no additional charge. So very powerful for our members to have that. And we provide that at no additional cost. We also provide a service called Second MD, which is access to some of the top doctors in their profession in the country. So Second MD has doctors at hospitals such as Mayo Clinic, Cleveland Clinic, and Johns Hopkins. And this particular service is for those members that are experiencing a non-emergency surgery. And so a good example of that is, let's say I have chronic back issues. I went to my doctor sends me to a specialist. The specialist thinks that I should have spinal fusion, and that's the best course of action. We would offer Second MD to me. I would pick up the phone, call Second MD or make an appointment, tell them what my doctor has prescribed and on the surgery. 2nd.MD will then gather all of the information from my doctor, the symptoms, the diagnosis, and determine if that is the right course of action or offer an alternative. Okay, so we provide this service for several reasons. Number one, 2nd.MD statistically has shown that doctors in the United States are behind 17 years in their education. So someone that goes into a doctor today in 2018, is the doctors actually utilizing information that they learned back in 2001. That's never a good thing. So with 2nd.MD, it puts the second eyes on the diagnosis and the course of action to determine if that is the right course of action. So we want our members to have the best healthcare and the best information provided to them, and that's our way of doing that. And just for using that service, we will credit back $250 to our members for utilizing that service. If they choose not to use 2nd.MD, we will only share up to 50% of those medical bills for not utilizing 2nd.MD. And the reason we do that is because if there's a different procedure that can avoid surgery and save the community money, that's one of the reasons we do that. Now, should a member call 2nd.MD and they offer the same opinion, then great. They're obviously going to go probably have that procedure done. But if 2nd.MD offers a different solution or a different procedure, our members have the right to choose whether they want to go with what their specialist suggested or with what 2nd.MD suggested. We empower them to choose what route they want to take. And at that point, those bills would be shareable at 100%. We also offer a counseling service. When a member joins, we've partnered with Head to Heart Restoration, and our members have 3 50-minute counseling sessions. Could be done over the phone, video, or face-to-face, but it's our way of welcoming them to the community. Lastly, member advisor, and we refer to them as our members' coaches. They sit right here in Austin, Texas, in our headquarters, right next to the sales office, and they are paramount in the experience our members have. We encourage our members to call with any questions they might have, and our member services is there to help them, whether it's pre-negotiation on making an appointment for a self-pay patient, medical record transfers, health cost estimates, whatever the case may be, our members are there to help. So preventive care. Right now, under Access, which is the association and grouping of individuals membership, we have these 3 items rolled in where there is $0 IUA, meaning if you're over the age of 50 and go have a preventive colonoscopy and a preventive mammogram, those are shareable with the community, and there is $0 out of pocket for our members. We also have included childhood vaccinations as well. Now, come January 1st, 2019, it is expected that Sedera Select will have those 3 included in our membership as well at no additional cost. So the small to medium costs, how are those handled? We just walked through what it looks like on the large costs, but how do you handle the small to medium costs and when in going to a doctor? So I mentioned the 24/7 teledoc. Obviously, that's a great option, and typically, on average, they can mitigate about 70% and triage that over the phone and get the patient or member taken care of. But there's going to be that other 30% in times when you just want to go see your doctor. So how does that look? When our members walk into a doctor's office, they walk in as a self-pay patient. There is no insurance card from Sedera. First and foremost, we're not insurance, but there is no card that they're going to walk in with. So the way it would look is when our members call to make an appointment, they call up and say, "Hi, this is Bill Thomas. I'm coming in. I have a sore throat. I'm a self-pay patient. I'd like to know what my self-pay rate is." We teach our members to get a quote over the phone, okay? Sometimes they'll provide a range because the doctor doesn't know what kind of codes they're going to fill out when you get in there. But it's, if you specifically know what you're coming in there for, 9 times out of 10, our members will get a quote over the phone. So when I walk into the office, I hand the admin sitting at the front desk my HSA card or my credit card and pay for my visit. So anything that falls under my IUA will come out of my pocket. Now, let's walk through the example of that sore throat. I walk in, I thought it was strep throat. They do a test. I pay the office visit and I pay the strep, and it comes out to $220. They call me back and they say, Bill, you know what? It's not strep. We'd like you to go have your throat looked at. There's some concerns. We saw a bump back there. Next thing you know, I'm over at a gastroenterologist and I'm having an endoscopy done. The endoscopy finds out that I have Barrett's, which is erosion of the esophagus. Now my bills are into the several thousands. Well, all of those are considered one need. So even that first visit of the sore throat, and it rolled into bigger and unfortunately a worse result, all of those are the same need, and all those can be sent to Sedera, and they're all considered one need. Lastly, there's the preventive care. You know, when you join Sedera, with the Affordable Care Act, with the law, the individual mandate is, the penalty is going away as of now, January 1st, 2019. But you can pair Sedera with a MEC. There's MECs that qualify, have the framework to qualify for an HSA. There's MECs that have copays, and there's other MECs that wrap it in with a direct primary care relationship. That's entirely up to the broker and entirely up to the employer group on what makes the most sense. So that's it for my presentation. I appreciate you joining today, and happy selling.